I cannot even begin to describe the amount of times I've seen something happen in medical school that I've been like, I wish everybody knew about this. And so we're going to cover the top 10 things I've learned in medical school that I wish everybody knew. This first one, you already know. It's really bad for you to smoke. I really wish people understood the extent of just how many things smoking can contribute to. For example, on my OB-GYN rotation, I sat in on a woman getting a procedure to cut a piece out of her cervix to check for cancer because they had found some atypical cells on her pap smear. The doctor explained to her that her major risk factor for these atypical cells and the potential for future cancer was that she had smoked in her youth, which damages the ability of the cells to clear the HPV virus that later leads to cervical cancer. The fact of the matter is that smoking is a risk factor for so many things beyond just the possibility of lung cancer somewhere in the future. I can't emphasize enough the amount of patients I worked with that were suffering in the hospital because of the results of smoking for decades, for their whole life. And these patients didn't necessarily have lung cancer. They had COPD exacerbations. They had heart failure that was made worse by the lung consequences of smoking. They were in pain. They were scared. They were hooked up to ventilators and unable to talk. And this was a huge portion of the patient population. For those of you who smoke, I know you've been told this time and time again by your own doctors. You're aware of the potential consequences. But I strongly urge you, if you haven't looked into it already, to go talk to your primary care about what assistance they can offer you to help quit. Because if you saw this from my perspective as a student, you would understand just how worth doing it is. Number 2. Control your weight. And I do say this with the understanding that it's a lot more difficult than it sounds. I'm also somebody who struggles with healthy habits surrounding weight, exercise, eating correctly. I know that it's complicated and it's hard, but seeing what I've seen in the hospitals, I can't not add this to my list. I've seen too many patients of a ridiculously young age dying in the hospital from heart failure related to their obesity or other obesity-related conditions. I've seen too many surgeries where the surgeons have to dig through the fat that's surrounding and engulfing the organs to get to the organ that needs help. Seeing it this way makes it really tangible just how bad the effects of obesity can be. It's a uncomfortable, sensitive, even controversial topic, but I can tell you as somebody who also has had to start, restart, try again, over and over and over to develop some real sustainable healthy habits for myself. If you had seen what I've seen, you would think it's worth doing as well. So if you're somebody who struggles with this, keep trying, keep getting back up when you fail, keep going, because it's really important and really good for you. Number 3. Control your blood pressure. Blood pressure is another one kind of like smoking that kept coming up in lectures time and time again as a major risk factor for so many things. It's very insidious. It doesn't always feel like there's a problem, but then out of nowhere can pop up and be a really, really big problem. For example, high blood pressure is one of the leading risk factors for stroke, among a lot of other things. That's why it's important to take it seriously when your doctor checks your blood pressure at your routine appointments, tells you have high blood pressure, and recommends some kind of therapy to treat it. You don't want the crisis level with your health to go from 0 to 100 because you felt fine and weren't willing to have a conversation about managing high blood pressure. Similar to high blood pressure, diabetes is another one where you likely won't be able to feel the effects, especially if you're dealing with mostly chronic elevations and not having very many lows. However, it's another one where I cannot emphasize enough how many patients I saw in the hospital who were there for really serious complications of unmanaged diabetes. I saw a lot of really awful infections, large-scale amputations, a new need for dialysis because patients weren't controlling their diabetes for a lot of years where they felt fine. Essentially, if you want to keep functioning kidneys, all your limbs, it's really important to control your diabetes now, even when it doesn't feel like it's a big deal. Unless, of course, you have no interest in keeping your feet. Hypertension and diabetes together are actually really good examples of number 5, that a lot of medical conditions can be really insidious and don't feel very bad. In medicine, we see the full spectrum of people who feel really bad but have nothing going on, to people who feel almost nothing but are in a really serious condition. Essentially, though, when you feel really crummy, it shouldn't be ignored in case there is something going on. It's also not really reliable as an alarm for every possible medical condition. There are a lot like hypertension and diabetes where the symptoms can be almost non-existent, or that they're so subtle that you don't even notice them, or are easy to confuse with just getting older. So we can't really rely on what we feel, what the patient feels necessarily to be a good indicator for their health. So the takeaway here is there's a reason why medical providers recommend routine appointments, routine screenings. It's to catch those things. That's why the routine thing to do at a doctor's appointment is to get your blood pressure checked, because blood pressure is one of those things where we might not necessarily feel it, so we screen for it via those checks. Number 6, the difference between a diagnostic test and a screening test. Something that I see online a lot is somebody getting frustrated when their doctor won't order them a specific test or imaging. And I don't think one of the reasons is explained well enough. Essentially, there are 2 types of testing, and the difference between how they're used has to do with what statistics has shown them to be useful for. The screening test is one that has been shown by the statistics, by the math, to be useful in checking a largely asymptomatic population to find hidden cases. These are your things like your hypertension blood pressure screenings, or STI tests, or routine mammograms, routine prostate checks. Those are the tests that screen for something that you may or may not have, because the math shows us that it's worth screening the population via these methods. The diagnostic tests, on the other hand, are shown by the math to be useful for checking a specific patient who has some sort of symptom or other reason to expect they have a condition for that specific condition. An example of this is actually the test we talked about earlier, where the woman had a piece of her cervix removed to check it for cancerous cells because they had found on her pap smear a reason to be suspicious that that might be present. The diagnostic tests are used in this specific way because the math shows us that were they to be used on a more wide-scale screening basis, that it would actually cause more harm than good, or that there's simply zero benefit to using them in that way. The pap smear itself is actually an example of a screening test. Lots of asymptomatic people get those, like this woman did, and that's how they found that there was reason to be suspicious and she needed a further diagnostic test. This difference between screening and diagnostic tests is only one of many reasons why a patient might be frustrated that a provider is not ordering them the test that they would like. However, I do think it's an important one because we have a lot of math to back up using the tests in this way. And it would be doing you a disservice for your provider to order you a test that goes against the typical and well understood to be beneficial use. Similarly to number 6. Number 7 is that there are some times when further testing or imaging actually is associated with worse outcomes for the patient. The one of these that I'm most familiar with is imaging orders for low back pain in patients that lack a specific set of symptoms from a list that's considered red flags for a more serious cause of low back pain. There was actually a wide-scale campaign called Choosing Wisely that included this issue with low back pain orders in addition to several other types of orders that were found to be associated with worse outcomes for the patient when ordered too soon or too frequently. In the Choosing Wisely campaign, the whole point was to encourage providers to not overuse these tests and decrease the negative outcomes that were associated with doing so. So when you go in to see your provider with some sort of pain or some other symptom that you want looked into, don't get frustrated when your provider doesn't jump right to ordering you further imaging, blood work, etc. Rather, take them up on their recommendation to start with the conservative management. In the case of low back pain, rest, ice, heat, light movement, some stretches, some PT, because the reasons that those are being recommended is because they are associated with better outcomes for patients in your circumstances. That data, those associations, is how your doctor makes that decision to offer that to you in the first place. And of course, there are diagnoses where the opposite is true, where the further workup is associated with better outcomes for the patient than the conservative management. And in those cases, your doctor will skip the conservative management and go straight to the further workup. The protocols that your doctors are taught in their medical education and that they use to make decisions as to how to proceed with the symptom profile that you bring to them is based off of this kind of data that tells us what is the best option, the first line approach. And sometimes that's not intuitive, like in the case of low back pain, where it's associated with worse outcomes for a patient to have that investigated further. So really, listen to your doctor's recommendations about how to proceed based on your symptom profile, because there's very likely a lot of data that went into them making that decision for you, and they're basing it off of what does the data show is most likely to have the best outcome for you. Number 8. If something doesn't have side effects, it doesn't have effects at all. The pathways that medications use to act on the body don't just appear in one specific place most of the time. Rather, there are places throughout the body that those same medications act, so the potential for side effects always exists. This is frustrating as a provider because it means there's never an option to provide a patient with a prescription that has zero potential for additional harm. However, from a patient perspective, it's a really useful mindset shift because it can actually be really helpful in assisting you and your doctor in making the best decisions for your your health. It stops your expectations for your treatment from being, I have a problem, this medication will make it go away, to, I have a problem, here are my options for treating it, here are the potential pros and cons of each of those options, and here is how my doctor and I have come to a conclusion together as to which of those options is most likely to benefit me and minimize the harm. Essentially, it's helpful to know because it allows you to make more informed decisions about your own healthcare, which allows you to have more agency over your healthcare and over your body and your health in general. A particularly noteworthy example of this is actually our 9th point here, just how dangerous over-the-counter medications can be. This same concept of if something doesn't have side effects, it doesn't have effects at all, applies to over-the-counter medications. The classic example of this is over-the-counter pain meds like Motrin, which are widely available but have significant potential for harm, such as kidney dysfunction and GI bleeds. Not to mention, in addition to their own side effects, lots of over-the-counter medications can have a whole new slew of side effects when interacting with medications that you're taking by prescription. The classic example of this is warfarin, which requires a really tight regulation of what you intake, including supplements like vitamin K, which can have significant impacts on how the drug functions. The takeaway here is that it's important to be aware that over-the-counter medications and supplements have equal potential for side effects as prescription drugs do, especially if you have a known medical condition or are taking any medication. Plus, it's always okay to ask your doctor if something has any potential benefit for you or any potential harms, especially as it pertains to interactions with your current medications. And follow the directions and recommended dosages on the package or the instructions that your doctor provides you alternative to those. And our last point, number 10, is no fun at all, but is very important and would prevent a lot of suffering if more people were aware. Have your end-of-life discussions as early as possible. In the hospital, we see so many people of every age group, every life circumstance that have had something unexpected happen that's put them in a critical medical condition, and far too often with their family having zero idea what their wishes for that circumstance are. I've seen far too many patients' family members truly suffering, truly dealing with heartbreak for not knowing what their loved one would have them do in the critical situation that they've found themselves in. The best practice is not only to have these frank discussions with your family members, what your wishes are for such a circumstance and who you would like to make medical decisions on your behalf, but also to get your wishes in writing. And it's worth looking into to make sure that your wishes are respected if something unexpected happens to you. The legal process for this varies by state, but a good place to start is with your primary care provider who can give you advice as to how to start. It's a kindness to your family to let them know what you would like them to do, to have it in writing what you would like them to do, because it lowers their burden should something happen to you to help them make decisions that honor your requests. It really makes a big difference to the people who love you the most on one of the worst days of their lives. And with that last somber note, these are only 10 of the many, many things I've learned during medical school that I really wish more people would know about because of how useful they could be. So let me know in the comments below if a part 2 of this would be useful for you.